My name is Donald Barr. I'm a professor of pediatrics in the Stanford University School of Medicine. I'm trained both as a physician and as a sociologist. I am the author of a paper titled The Childhood Roots of Cardiovascular Disease Disparities that will appear in Mayo Clinic Proceedings. I was on a national panel convened by the American Heart Association to look at the social determinants of cardiovascular disease. One of our conclusions was that children raised in disadvantaged socioeconomic circumstances are often at increased risk of cardiovascular disease throughout their adult years. It's often been assumed that this increased cardiovascular risk is due to behaviors such as smoking, diet, exercise adopted in childhood and adolescence and continued throughout the adult years. However, there is a growing body of evidence that high levels of toxic stress in early childhood can lead to increased allostatic load and chronically elevated levels of cortisol that can trigger early atherosclerosis in children. The chronically elevated cortisol identified in children as young as 4 years has been shown to trigger the release of inflammatory proteins that lead to the thickening and stiffening of the lining of the arterial circulation. And these atherosclerotic changes have been found in children as young as 18 years of age clinically and have been shown to be associated with increased cardiovascular risk throughout the adult years independently of behavioral patterns. I think if there's a single takeaway, it's that high levels of childhood stress place those children at increased risk of cardiovascular disease as adults independently of behavioral patterns. The American Academy of Pediatrics has recommended that pediatricians and other providers screen young children in their practices for potential high levels of toxic stress in the home environment, and when identified, to take steps to reduce those stress levels so as to reduce the levels of health risks as a consequence, both overall health and cardiovascular health. In this context, the patient really is the parents, and it means that parents who are raising children in high levels of toxic stress in the home or community environment should be aware of the potential health hazards of that stress alone and should work with a pediatrician or other provider to try and identify steps they can take to reduce the stress level of the children and the consequent cardiovascular risks. I think that the main research issues we need to look at are, number one, which screening tools are most valid and most useful in looking at young children in the clinical environment, and then, of course, which interventions to reduce stress are most effective at reducing stress and at reducing the subsequent cardiovascular disease risk. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.